What's going on, everyone? Happy Thursday. Hopefully, everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for all those viruses that can make us sick. It is time now for the Thursday edition of the Virus Update for Thursday, October 2nd, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, but not enough information being passed around of what's going on with these viruses. That's what I do here on my channel. I give you the latest news, data, information, anything I can find across the internet to help keep you safe and informed of what is going on. Want to stay informed? Just subscribe to my channel down below. Give today's video a thumbs up if you like it. Of course, the more people that do that, the more YouTube's going to push us throughout the algorithm, which helps keep more people informed. And of course, hit that notification bell, share this video with anyone you know, and leave your comments down below. Already, we do have several pieces of data, post, news, a lot of things to get through today, and we will be spending some time internationally today. Yes, we don't just talk about the United States here. We do talk about places all around the world, and we start off with just that today from Dennis, the COVID info guy, where in New South Wales they do have the weekly respiratory surveillance report, week ending the 27th of September 2025. Some good news here out of New South Wales. The COVID positivity rate is 2.9%, or down by 0.2%. Number of laboratories reporting COVID, 3 out of 4. COVID cases, 951. That's down by 9.9%. Influenza, 3,513. That's down by 14.2%. RSV, 825 cases. That is down by 10.9%. Here in the United States, we have entered fall. Over in Australia right now, they are in spring, so they are slowly coming out of the winter months. Taking a look at the variants. New South Wales, NSW, COVID-19 sequencing, we do see last updated on September 20th, the NB.1.8.1 variant is 47% of the estimated cases, XFG now at 28% of the estimated cases, and PE.1.4 is now at 25% of the cases. This is one you don't hear much about. It's one I'm actually going to have to write down. Haven't heard about it in other countries yet. I keep looking at different variants and have not seen anything about that. So that's something to keep an eye on. And we do see here, it looks like 2 out of the 4 wastewater locations there are dropping at this time. Now moving on to this from Dennis, the COVID info guy. Thailand detects 33 cases of the XFG COVID strain. As you know, XFG has been the one that we've been following the most here on the channel. Why? Because, well, here in the United States, it's what's caused the summer wave, and some countries still are just starting their XFG wave. Thailand may be one of them. As of September 24th, 33 cases had been reported, with most found in Public Health Zone 13, which recorded 23 cases. The variant that is predominant there, the most dominating variant is actually the NB.1.8.1 variant. That variant popped up just before XFG, and that makes up 73.7% of the cases there. XEC, 8.7% of the cases. JN.1, 6.4%. XFG, of course, 5.4%. And other variants would be 5.7%. All right, moving on now to this. This is interesting. I don't know if we've used this dashboard before, whether we've looked at it before. Of course, it may be something that we start to use. The European Wastewater Surveillance Dashboard. Yeah, I don't know. Is this new? Someone let me know. I'm just starting to see a lot of people post this on X. 13 dashboards connected out of 42 available. Yikes, I wish we had all 42. 13 countries connected. 808,024 measurements and 3 pathogens. 100 pathogen subtypes. So let's take a look at this, shall we? And we can see some different countries. Austria, looks like they were rising most of the summer. And then at the very end there, looks like they peaked and started to drop, similar to what's happened here in the States, the United States. France, Unfortunately, France is still seeing a rise at this time, and a pretty big one at that. And then we do see Germany is continuing to rise significantly as well for COVID. And unfortunately, I wish we had wastewater for the UK. I really do, but the UK stopped their wastewater a few years ago, which, in my opinion, is totally ridiculous. In just a few minutes, we'll look at the new update for COVID numbers from the UK. But first, some stuff from Glador now. COVID hospital admissions in Scotland. Number of acute COVID-19 admissions to hospital data to week 39 ending on September 28th. And you can see here, though they are down from their peak, they are up from the previous week. So that did go up a little bit. And COVID hospital admissions in Northern Ireland, this is not good. They actually just hit a new high for this particular wave. They continue to go upward. You can see that here. Take a look at this. Yeah, pretty significant increase in weekly admissions going on right now for the last couple of weeks. So that is not good whatsoever. And it is the highest level since week 29 of 2024. So not a good thing there. Moving on now to the UK. And, well, we see the UK has seen a significant rise. And I say this is significant because, number one, weekly cases, 2,459. That's up by 447, or 22.2%. And remember, and I'm looking for it here, I usually have, here it is. This is what I wanted to show you. At-home testing is a pretty big deal there. I said that in my post. I did a little breaking news book. I don't usually do that. There's a lot of accounts on X that put breaking for every little thing. Only once in a rare while will I do that, and same holds true here for these videos. Very rare do I have a day where I put breaking in the title. I think I've done it less than 10 times. I don't know. But the point is, this is pretty significant because at-home testing is where most people do their testing, and the fact that cases went up 22.2% with a lot of cases not being reported thanks to at-home testing. Yeah, their wave is getting worse. And up to September 19th, 11.4% positivity rate. Deaths, 82, that's up by 4. Hospital admissions up, but come down to this. Take a look at this. There was a peak here on September 24th of 12.03% positivity rate on that chart. So, yikes. The UK continuing to get worse for COVID. Hopefully we are nearing a peak in the UK, and I should show you this. This has been a very long duration wave. The positivity rate, let's go back to that chart for a second. The positivity rate actually started slowly creeping up back in January, and it's just been inching up almost every week. April into May it went down a little bit, and then June it dropped a little bit. You know, there were a couple of drops and then up again. Hey, if this was a stock on a stock market and you owned this stock since January, you'd be doing pretty good. But in this case, we're talking about COVID cases, COVID positivity rate, meaning COVID transmission has been going up. And there are two things that can be really bad with that. Like, for example, there are two things that can be bad. One, you get one of those quick waves where everything goes up really quick. That overwhelms healthcare. But here's why a long duration wave is bad. When you're dealing with longer periods of time of elevated transmission, you know what's happening? There's a longer period of time that it's risky to do things. So I am sure there are a lot of people in the UK that are high risk, that take COVID seriously still, that take a look at this, and they've been delaying to go get healthcare treatment just because, hey, they see that they're in a long-term wave there. Yeah, not a good thing. And like I said, I hope we're going to see a peak soon. They're going to be heading to colder months not too far around the corner. So I don't know what's going to happen. This has been a very long duration wave, and this is the highest that wave in the UK has been yet. All right, Spain now. Yep, we're still international. 4 elderly people die after an outbreak of COVID at a nursing home in southern Spain. This is not good. 4 people have died. There's also 22 total cases there, and influenza A is starting to pop up. Yeah, this is concerning with the influenza A business. I think what's going on, we had our COVID wave here in the United States in the summertime. I think Europe is now starting to follow the U.S., but influenza gets going over in Europe before it does in the U.S. So influenza over there could still be an indicator of what's to come here, even though we flipped with COVID. You may recall in the early days of the pandemic, Europe was a good indicator. The UK was a fantastic indicator of what was to come here. And now the tables have just reversed themselves, I think. All right, moving on now to this. You remember, well, maybe you do, maybe you don't. If you were a fan of 90s alternative and rock, you may have heard of the band called the Lemonheads. Yeah, they were big back in the 90s. Believe it or not, they did a cover of Simon and Garfunkel's Mrs. Robinson, and it was actually pretty popular at the time. Well, one of their lead people is not doing well. Is doing pretty bad right now. Is actually tested positive for COVID. That's right. Evan Dando canceled his UK show after testing positive for COVID-19. We've been starting to see, that's one of the things I search over on Google is positive for COVID. Results are starting to show up more. It's just showing you that around the world right now, things are elevated. I think on a worldwide scale, COVID is increasing. Yes, we have peaked here in the United States. Yes, I'm going to show you some things in a little bit that prove even more that we have peaked in the United States. But with Europe rising at the moment, things, a lot of these celebrities travel to different places around the world, and COVID can easily be picked up when you are doing that. And as you see here, Evan Dando, the Lemonheads, tested positive for COVID. The fact they're actually listing COVID versus just saying illness, that's really interesting. Alrighty, moving on to this. Britain's Got Talent. You know how we have America's Got Talent here in the United States? Well, there's also a Britain's Got Talent. They're having problems. It looks like they are dealing with some illness at this time. You may have heard of the person, of course, if you watched American Idol back in the early days, I believe he was on that, Simon Cowell. Yeah, well, guess what? He's dealing with illness right now, and because of that, it looks like auditions, at least the first day of auditions, have been called off as a result of that. Alrighty, now moving over to the United States. Yeah, that was a lot of international news and data, wasn't it? 4 more turkey farms in Minnesota are being hit by bird flu, officials report. Yes, H5N1, the migration south of birds right now is causing for there to be increased cases of bird flu. In Jefferson County, I believe this is Wisconsin, there is also another round of bird flu going on there. Yes, we just reported on this area a few days ago, and now they have found another flock has tested positive for avian flu, H5N1, spreading once again due to the migration south of birds. Let's take a look at that, shall we? How many million birds migrated in the last 24 hours? And at the peak of last night, take a look at this. Yes, well north of 400 million birds. In fact, almost 500 million birds, a huge migration in the east, also in portions of the plains as well. So we're going to be keeping an eye on these areas for increased cases of bird flu. Taking a look at what's going on with our friends up in Canada. Can we do that? Yes, here we go. Let's see, is there any update? The COVID viral activity level in wastewater is moderate, flu A is low, flu B is low, RSV is also low at this time. And since we had that other page up, might as well show you this. Canada so far this year is well north of 5,000 cases of measles. 5,006 measles cases have been confirmed in Canada. And I thought I had a measles story up here for the United States about Minnesota. Yeah, Minnesota has found, I'm not going to give you the exact amount because I don't have the story up there, but Minnesota has found yet again several more cases of measles here in the United States. So that is not a good thing by any means. All right, let's take a look at what's going on with the air qualities in the United States. While we're waiting for that to load, let's pause and take a hydration break, shall we? Alrighty. Taking a look at what's going on with air qualities in the United States, and you can see from Minnesota on southward, we do have some yellows that are ongoing. That's not a great thing. The East Coast is doing well, pretty good. You can see a lot of greens here for the air qualities, which is a good thing. Also do have a few problems along the West Coast. From California, Oregon, Washington, generally right along the coast, still dealing with some bad air qualities, and Alberta, Canada, also dealing with some bad air qualities at this time. Taking a look at what's going on with EMS calls in Pinellas County, Florida, we do see that sick person is showing up a few times, and there are a few other calls at this time. Taking a look at what's going on in Philadelphia on Wednesday, 799 EMS incidents were reported. Taking a look at what's going on right now in Montgomery County, Pennsylvania, and we do see respiratory emergencies showing up 3 times. That could be anything from COPD to asthma to COVID or some other respiratory illness. Air qualities are very good here today. In fact, we have not even hit 70 degrees here. Yeah, haven't been able to say that in a while. It's warming up again here next week. We're actually going to go back to the 80s for temperatures in my area next week. Take a look at this. Chester County, Pennsylvania. 1 sick person call, a few respiratory difficulty calls right now. It's been fairly steady there today. I wouldn't say it's been really busy, but it's been steady there today. And taking a look at the hospital situation, and not liking Lehigh Valley on up into northeastern Pennsylvania. Yikes. Yet again, we're seeing a lot of hospitals dealing with problems there, so that's something we have to keep an eye on. Any hospital in yellow is dealing with some sort of an issue. Taking a look at what is going on with the hospital situation in New Jersey, and wow, take a look at this. All hospitals in New Jersey today are reporting green, normal. That is a good thing. We will take a look at the New Jersey weekly update either tomorrow or some point over the weekend. New York State weekly update with New York City being added in. New York State updates almost every day, but New York City does get added in on Thursdays. 835 cases. No increase. Take a look at this. Continuing to drop now. So you may be seeing all these posts. I mentioned the words how I don't like using breaking in posts. I did it today on XLK. It's very rare that I do that. I've been seeing some accounts saying, breaking! New York City has very high transmission. They may in wastewater. Yeah, of course, this could be missing cases thanks to at-home testing. But let's face it, at the moment, New York City has peaked. They peaked on or about September 15th, 1 week later than the national peaking. And right now, New York City and New York State cases are dropping, despite the fact that, hey, I'll admit, transmission is still very high in New York City. It's out there. Yeah, you could easily get COVID, but right now, the numbers are dropping in New York State, and let's further that. Here's more backing that supports that. More data. 446 people hospitalized, 47 people in the ICU. Those numbers, New York, they are clearly coming down. That is a good thing, but I do express caution. How low is that going to go before the next wave starts? Well, only time will tell. We'll have to wait and see, but at the moment, we are seeing the drop happen pretty quickly. All right, Ohio, hopefully something from Ohio. You see I'm refreshing this. It's supposed to update on Thursdays. Last update's on the 25th. Today is October 2nd. So you're seeing here at the moment, no update from Ohio. We'll see if we get anything tomorrow. And that actually does say the 20th of September. So yeah, nothing out of Ohio this week. All right, we do have some data from CJS. I wanted to show some wastewater, but well, maybe we will show one wastewater site. All right, CJS data. This is Tuesday, starting off with. And on Tuesday, Florida had 399 new cases and 1 new death. New York, 547 new cases. Puerto Rico, 205 new cases. Maine, weekly number, 207 new cases and 7 state-reported deaths. Maine is actually the state I wanted to show you. I'll show that to you in a moment. Maryland, 822 new cases and 19 new state-reported deaths. Virginia, 1,758 new positive tests, 147 CDC reported hospitalizations, and 14 deaths reported provisionally by the CDC the past 2 weeks. Wednesday numbers. Florida, a daily number of 487 new cases and 15 new deaths. With that, Florida has now totaled over, 101,000 state-reported COVID deaths. That's ridiculous. New York, 464 new cases, daily number. Puerto Rico, also a daily number, 219 new cases. Oregon, 313 new positive tests, and 8 new state-reported deaths. And Washington, hey, signs are that you may be dropping now. Peak, yes, dropping for COVID. 783 emergency department visits and 13 new state-reported deaths. Quick reminder, as we pull up wastewater, that though I say some places may be dropping now, the backside of a wave is still dangerous, and you still can test positive for COVID on the backside of a wave. Alrighty, I have to show you this, and I'm going to show it to you on the map. Portland, Maine has a problem going on right now. Yes, Portland, Maine. Take a look at this. COVID is medium at this time and dropping. RSV, very low, but maybe in the early stages of rising. And, oh, wait a second here. That's not Portland, Maine. That's the national level. We want Portland, Maine. I promised you Portland, Maine, and in Portland, Maine, I will show you. There is Portland, Maine. I knew they were dropping for COVID. COVID is dropping in Portland, Maine at this time. RSV, very low. Disregard anything I said about that. But take a look at this. Influenza A. Now, this could easily correct, and I think it will correct, but at the moment, it is coming up that Influenza A is on the rise in Portland, Maine, and is listed at high. That's something we're going to have to keep our eyes on. And we showed one place in the east. Whenever we do that, we have to show somewhere in the west. I think it's only fair. So let's set this to national, set it to COVID. Let's go somewhere in the west. And hey, look at this. California. Now, there are some places grayed out. Look at that. You're not seeing high listed anywhere in California. That's a pretty quick drop, if you ask me. I would show you San Diego, but that is now grayed out. Let's go to Sacramento. Yeah, look at that. It is just steadily dropping in Sacramento at this time for COVID. That's some really good news. And hey, we've talked about a lot of different things today. If you enjoyed today's update, give it a thumbs up. If you're new here and you enjoyed what you saw and you want to see more of this and you want to help me reach my year-end goal of 10,000 subscribers, subscribe to my channel down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. And when doing so, hey, please remember to let me know where you're chiming in from. And maybe there's something you want to see that you're not seeing here. Maybe it's a wastewater site. Maybe it's something else. Let me know down below. If I can find anything about it, I will report about it. Alrighty, folks, I'll see you again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Thursday afternoon. Thanks for watching.